Infection control is a critical part of a certified nursing assistant's (CNA) responsibilities. Understanding how to prevent the spread of infections protects both residents and healthcare workers. Two essential processes in infection control are disinfection and sterilization. Though often used interchangeably, they are different methods with distinct purposes and procedures. Let's begin by understanding the foundation of infection prevention. Infection control and the role of disinfection and sterilization. Infection control refers to practices used to prevent and reduce the spread of infectious agents such as bacteria, viruses, fungi, and parasites. These practices protect residents in nursing homes, hospitals, and other healthcare facilities from healthcare-associated infections, also known as HAIs. Infection control involves key measures such as hand hygiene, the use of personal protective equipment, and the proper cleaning, disinfection, and sterilization of equipment and surfaces. Why are disinfection and sterilization important? Medical instruments and equipment often come into contact with blood, bodily fluids, or broken skin, common entry points for pathogens. Without proper cleaning methods, these tools can transmit harmful microorganisms between patients and healthcare workers. Disinfection and sterilization are designed to reduce or completely eliminate pathogens on surfaces and instruments. These processes are essential to breaking the chain of infection. Knowing when and how to use each method is critical for ensuring patient safety. In short, infection control, and especially disinfection and sterilization, form the backbone of safe and effective healthcare practice. Now, let's take a closer look at disinfection, an essential step in keeping healthcare environments safe. Disinfection is the process of eliminating many or all pathogenic microorganisms on inanimate objects, except bacterial spores. While it does not destroy every microorganism, it reduces microbes to a safe level. There are 3 levels of disinfection. High-level disinfection kills all microbes except large numbers of bacterial spores and is often used for semi-critical items such as endoscopes. Intermediate-level disinfection destroys mycobacteria, most viruses, and bacteria, but not spores, making it suitable for surfaces or non-critical items like blood pressure cuffs. Low-level disinfection removes some viruses and bacteria, but not spores or mycobacteria, and is used on surfaces not exposed to blood or bodily fluids. Common disinfectants include chlorine compounds such as bleach, alcohols like ethanol and isopropanol, phenolics, and quaternary ammonium compounds. These disinfectants work by damaging microbial cell walls or disrupting enzymes, which makes the microorganisms inactive or dead. Disinfection is used for cleaning surfaces like bedside tables, counters, and floors, processing equipment that contacts intact skin such as stethoscopes, or during outbreaks when infection risk is high. In short, disinfection is a key tool that controls harmful microbes and helps stop the spread of infections. Next, let's move to sterilization, the highest standard of infection prevention. Sterilization is the complete destruction or removal of all forms of microbial life, including bacterial spores, viruses, fungi, and vegetative bacteria. This ensures an object is entirely free of microorganisms. There are several methods of sterilization. Heat sterilization includes autoclaving, which uses high-pressure steam at 121 degrees Celsius for 15 to 20 minutes, and dry heat sterilization, which uses hot air ovens at higher temperatures for longer periods, such as 160 degrees Celsius for 2 hours. Chemical sterilization involves gases like ethylene oxide for heat-sensitive instruments or liquid chemical sterilants such as glutaraldehyde. Radiation sterilization, which uses gamma rays or electron beams, is primarily done in industrial settings. Sterilization is used for surgical instruments, medical devices that enter sterile body sites such as catheters, and items that come into contact with broken skin or mucous membranes. Sterilization works by killing or destroying microorganisms through denaturing proteins, destroying nucleic acids, or oxidizing cellular components. Now let's compare disinfection and sterilization to clearly see how they differ in infection control. The goal of disinfection is to reduce or eliminate most pathogens, but not spores. The kill level can be high, intermediate, or low, depending on the method used. Common methods include chemicals, boiling, and ultraviolet light. It is mainly used for non-critical and semi-critical items. The process takes a shorter amount of time, usually minutes to hours. Examples include disinfecting floors or cleaning blood pressure cuffs. Now let's move on to sterilization, which goes beyond disinfection. The goal of sterilization is to destroy all microbial life, including spores. Its kill level ensures complete destruction of microorganisms. Methods include autoclaving, dry heat, chemical gases, and radiation. Sterilization is required for critical items that contact sterile body sites. This process usually takes longer, varying by the method used. Examples include surgical instruments and medical implants. In short, disinfection lowers the risk of infection, while sterilization ensures absolute safety by eliminating all microorganisms. Now that we've covered disinfection and sterilization, let's look at how these concepts apply in the daily work of CNAs. While CNAs do not usually perform sterilization or advanced disinfection, understanding the principles helps them. They can properly clean and disinfect patient care areas and equipment as instructed. They can also recognize which items require special handling and avoid contamination. In addition, CNAs assist with infection control protocols by reporting issues with cleaning or equipment. And finally, they support safe handling and disposal of contaminated materials. In summary, CNAs play an important role in infection control by applying these practices consistently in patient care. Mastering the concepts of disinfection and sterilization is fundamental for CNAs to prevent infections effectively. Disinfection reduces harmful microorganisms to safe levels, while sterilization completely eliminates all microbes. Knowing when and how these processes are used ensures that CNAs contribute to maintaining a safe healthcare environment. This knowledge not only helps protect residents and staff, but also prepares CNAs for success in their certification exams and professional practice.